Today we're going to be giving a technique guide for visualization of the anterolateral ligament with magnetic resonance imaging. We have no pertinent disclosures to this technique. The radiographic parameters for ALL visualization with MRI, we prefer a 3.0 Tesla MRI as opposed to a 1.5 Tesla MRI. The slice thickness is ideal between 0.5 and 1.0 millimeters. A dedicated knee coil is nice if it is possible. The knee should be in approximately 15 degrees of flexion with neutral rotation. With the size of the anterolateral ligament being so small, it's only visible on the coronal and axial imaging. We prefer a proton density with fat saturation sequence in order to best visualize this ligament. This is a coronal image of a knee. You can see, looking at the proximal aspect, you can see a confluence of origin of both the FCL and the anterolateral ligament origin. The anterolateral ligament origin tends to be more distal and anterior in relation to the FCL, but this is somewhat variable from patient to patient. The ALL then traverses distally and slightly anterior. It's helpful to locate the popliteus deep to the ALL origin and follow the ALL origin down to where you see the lateral inferior geniculate artery. At the lateral inferior geniculate artery, just superior to this, you should have the meniscal branch of the anterolateral ligament that you can see bifurcating from the ALL more proximally to the meniscus. As you move distal to the lateral inferior geniculate artery, you see the tibial branch of the anterolateral ligament, which inserts on the tibia approximately 5.2 millimeters distal to the tibial plafond. This is an axial image at the level of the lateral epicondyle. The origin of both the FCL and the ALL, as previously discussed, are both at approximately the same area. The ALL, again, tends to be more distal and anterior in relationship to the FCL. It is important to move from posterior to anterior when analyzing a coronal MRI when looking for the anterolateral ligament. Structures that are helpful to identify when trying to find the anterolateral ligament include the biceps femoris, the FCL, and the IT band. Now we're moving slightly distally. Again, we locate the biceps femoris posteriorly, the FCL. In between the FCL and the IT band, approximately midway, you're going to see a density in the capsular structures. This density is the anterolateral ligament. The anterolateral ligament was once thought to be a capsular thickening. Histologic studies have shown us that anterolateral ligament is actually more ligamentous than capsular, containing high volumes of type 1 collagen. And finally, as you get to the insertion site of the anterolateral ligament on the tibia, it is again important to note the fibula collateral ligament and the IT band. Halfway in between these two structures, you see a thickening of the capsular tissue, which clues you in to this being the anterolateral ligament. Thank you very much.